What might be the reason for cheek implant infection on both sides? Is it related to health situation? I had cheek implants, but I had them removed due to infection after 1 month. Since it's very rare for them to be infected, is it strange that I got infected on both sides? Can it be related to any health problems or body defense? Do I need a health checkup? What might be the reasons for infection on both sides? Any alarm that I might have any health problems? Thanks a lot if you can help me. I'm falling into depression.
Thank you for your question. You submitted your question without a photo, and you state that you had cheek implants removed after 1 month due to infection in both of them. And you state that it's certainly rare for this to occur, and you have some concerns. You're concerned on whether or not you have some underlying issue with your body's defense, and you're looking for certainly some degree of explanation, and you end your question saying that you're falling into a depression about this event. Well, in the absence of knowing your full medical history or any other important details, I can give you some general ideas about what I would consider when something like this happens, and something that you should also understand about what the risks are when you place any type of foreign substance in your body. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facial implants and as well as body implants is something that has been a big part of my surgery practice for this time. This includes cheek implants, chin implants, breast implants, and I can certainly tell you that there are so many variables that are important and can be somewhat related to what has occurred in your situation. But let's start with the simplest. The reality with cheek implants is we're placing it through the mouth. I mean, that's just a standard operating procedure. And the reality is that the mouth, even with extensive cleaning prior to the surgery and placing patients on antibiotics before surgery, we refer to this as a dirty area. This is an area where there's naturally a lot of bacteria. So when the implant is placed, and once the implant is placed and fixated, not only do we also irrigate that area with antibacterial solution, the placement of stitches in a way is to allow for any type of drainage to occur so that anything going on the inside can drain out. That being said, there is a potential risk. An implant doesn't have a blood supply, and so it is common for a lot of times just the most routine what's called bacteremia, where bacteria is in your blood, such as when you brush your teeth, can potentially seed the implant and cause this type of infection. This can happen to a cheek implant, it can happen to a chin implant, it can happen to a breast implant. It can happen to injectable fillers. You can place injectable fillers and nothing happens until suddenly somebody can develop an infection. Injectable fillers, we also think about the bacteria on the skin and going in even with good cleaning and causing something called a biofilm. So whatever it is we do in medicine, when we're crossing a natural barrier, there is the risk of infection, whether it's from the time of the surgery, whether it's from routine daily life. And in addition, there's also a greater, what we call, colonization of people's respiratory tracts and bodies with relatively resistant bacteria. I think this particularly applies to people who work in healthcare, working in hospitals and other areas where there's a lot of use of antibiotics, basically isolates a lot of resistant bacteria. And so it's become part of my routine to discuss with patients who work in hospitals about the relative risk of infections, whether it be MRSA or any other type of infections that can be due to just being in that environment and being colonized. We live in a very interesting time where antibiotics, whether it's used liberally in the medical field or used in the food products and the things we take in, has changed a lot and created a lot of risk relative to infections. Even when you're not doing implants, you can still get infections with any surgery. That being said, I would say that it's of course appropriate for you to discuss this with your medical doctor, have your medical doctor do routine lab tests, and just make sure that you are otherwise healthy. I would also say you don't want to just give up. I think that there is still potentially an opportunity for you to consider enhancing your cheeks, not necessarily with implants, but maybe something with like injectable fillers. And the reason why I'm saying that is that injectable fillers, such as those in the hyaluronic acid families, such as Juvederm Ultra Plus, Juvederm Voluma, these are long-lasting fillers that has become a major part of my own practice as a significant alternative to implants. I find that I find myself gravitating towards doing things such as this because of the control, the ease, and the convenience for our patients. And when it comes to the concern, of course, of potential infection, I think it's important that you bring that information to the prospective doctor. When we do this procedure, we actually do something called structural volumizing. And we do this like in a way where we do in surgery. We do everything in super sterile technique. We clean in a way that is as if we were doing a surgical procedure, even though it's done in an exam room, and place the filler using special instruments at the bone level so that you can get this nice natural enhancement without looking overly done. It's comparable to a cheek implant. The good thing, the other thing that's really nice about this method, if you were to have an infection, it's not a surgical solution. We can actually dissolve the filler with an enzyme called hyaluronidase. And once the foreign body, as I discussed earlier, is gone, which is the filler, then the bacteria has nothing to really to live on top of. So I think that you should allow yourself a chance to heal after this procedure, discuss this with the doctor who performed your surgery, and discuss the option of having cheek fillers as opposed to another surgery. But again, it's a matter of the discussion between you and your doctor. So I hope that was helpful. I wish you the best of luck. Thank you for your question.